Hello, I'm Dr. Jeffrey DeSarbo, and welcome to the October edition of the Eating Disorder News Network. A study from Finland examined psychological distress and the risk for developing an eating disorder in subgroups of dieters in their adolescent years. Based on their own accounts of the reason for starting a diet, 81 participants, age 15, were interviewed at both baseline and follow-up with questionnaire data on depression, social phobia, and self-esteem. 4 mutually exclusive groups of dieters were identified, including vanity dieters, overweight dieters, depressed dieters, and feeling fat dieters. The results showed that the depressed and feeling fat dieters had a 15-fold risk of having a lifetime eating disorder at age 18, compared to the vanity or overweight dieters. This data suggested that dieting with and during psychological distress can be a significant risk for the onset of an eating disorder since, at least in this study, typical teenage vanity dieting and dieting among overweight adolescents did not appear to increase the risk of onset. The use of bright light therapy has been shown to be effective and of great benefit to patients who suffer from conditions such as seasonal affective disorder. Now, from the Netherlands comes a pilot study on the use of bright light therapy in reducing symptoms in women with chronic anorexia. Researchers examined the effects of bright light therapy on the sleep-wake rhythm, the menstrual cycle, mood, and key eating pathology symptoms in a small sample of women with chronic anorexia nervosa who had a mean duration of illness of over 15 years. Each woman received 5 daily sessions of 30 minutes of bright light therapy at 10,000 lux. Participants completed a diagnostic interview and questionnaires at pre-test, post-test, and at a 3-month follow-up. The results showed a slight improvement on core eating pathology and what was described as a fair decrease of depressive symptoms and a clinically important improvement on global distress. However, while bright light therapy had a short-term positive effect on the physiological and psychological well-being of chronic anorexic women, later follow-ups indicated that the effects were partially lost. Researchers recommended that it may be necessary to enhance the exposure period to the light and to repeat the treatments after 3 months. While light therapy may prove beneficial, further research into this area is necessary. Research on the relationship between dissociative experiences and binge eating episodes was conducted at the Cognitive Psychotherapy Clinical Center in Florence, Italy. While several prior studies support the hypothesis that there is a relationship between dissociation and eating disorders, the aim of this study was to assess whether eating disorder patients show a higher level of dissociation than healthy control individuals or psychiatric control patients with anxiety and mood disorders, as well as to investigate the effects of dissociation on eating disorder symptoms, specifically binge eating behavior. 54 eating disorder patients, 56 anxiety and mood disorder control patients, and 39 healthy control individuals completed the eating disorder examination questionnaire and the dissociation questionnaire as well. Data was collected regarding the number of binge eating episodes he or she had experienced over the past 4-week period. Results showed that the eating disorder patients had higher levels of dissociation than both the psychiatric control group and the healthy control group. Furthermore, in the eating disorder group, the number of binge episodes was related to the level of dissociation. Researchers also noted that in patients affected by the core psychopathological beliefs of eating disorders, including an overvaluation of shape and weight, that dissociation may allow an individual to initiate binging behavior, thus decreasing individual self-awareness and negative emotional stress, without having to deal with the long-term consequences of their actions. Researchers at the Innsbruck Medical University in Austria examined the current features and childhood factors of men with eating disorders. The study consisted of 32 men with eating disorders, 9 with anorexia nervosa, 15 with bulimia nervosa, and 8 with eating disorders not otherwise specified, as well as with 43 control participants with no such history, but similar in age and educational status. The structured clinical interview for DSM-4 was used to assess Axis I disorders, and a self-designed interview was used to assess actual social and sexual characteristics as well as childhood body-focused and social behaviors, including sexual and physical abuse. Study results that the two groups differed significantly with regard to clinical, sexual, and social features, with a 3 times higher rate of psychiatric disorders and fewer sexual and social relationships in the eating disorder group than in the controls. Eating disorder men also differed significantly from controls on most measures of body focus and social behaviors, displaying higher rates of thumb sucking, nail biting, autoaggressive behavior, and nudity as a familiar taboo during childhood, as well as receiving less parental body caressing than did the controls. The men with eating disorders additionally reported significantly poorer relationships with their parents, fewer friends and persons of trust, and they more often had adjustment problems at school than did their counterparts. The data supported a conclusion that disturbed interactions with one's body is associated with a body-denying and distant family climate, and with autoaggressive, anxious, and inhibited social behaviors during childhood. Rhodiola rosea, or R. rosea, is one of the most popular adaptogen and anti-stress plants in European and Asiatic traditional medicine. Often used for conditions including fatigue, anxiety, depression, and other medical conditions, there remains insufficient scientific evidence as to its overall safety and true effectiveness for these conditions. Its pharmacological properties appear to be dependent on its ability to modulate the activation of several components of the complex stress response system, including serotonin and dopamine, which may be mediated by the monoamine oxidase inhibition and its influence on opioid peptides. Much of the scientific research that has been conducted in the lab tends to focus on experiments using rats, including research into the effects of R. rosea on dysfunctional eating patterns. Prior studies demonstrated that R. rosea was able to selectively attenuate stress-induced anorexia in rats. More recently, a study out of Italy examined the effects of R. rosea with stress and binge eating behaviors. Binge eating for highly palatable foods was evoked in female rats by 3 8-day cycles of food restriction and refeeding, followed by an acute stress on day 25, the test day. R. rosea dry extract, consisting of 3% rosifin and 3.12% salidroside, or its active principles, were given 1 hour before access to highly palatable foods. Only rats exposed to both food restrictions and stress exhibited binge eating in the first hour after the stressful procedure, and R. rosea extract at 10 milligrams per kilogram significantly reduced binge eating behaviors, and at 20 milligrams per kilogram abolished the binge eating episodes. Furthermore, R. rosea extract at 20 milligrams per kilogram abolished stress-induced increases in serum corticosterone levels. Researchers concluded that R. rosea extracts may have therapeutic properties in binging-related eating disorders, and that salidroside appears to be the active principle responsible for this effect. But it is important to remember that this study was conducted with rats, and scientific evidence with humans is lacking, even though the supplement is widely available. Always have patients check with a medical doctor before taking any such supplements. I'm Dr. Jeffrey DeSarbo with the Eating Disorder News Network, wishing you a happy and healthy day.